Healthcare has learned a lot from other industries and really brought the broader concept of simulation into both clinical activity, research activity, and innovative activity. Healthcare delivery is also about teamwork and how individuals work together. So it's great for individuals to improve their skill, but ultimately, in order for them to deliver effective, timely healthcare, they need to practice working in teams. And so a simulation center allows people to come create an environment from which they can role play their professional activity, and then we can analyze and teach to teamwork and communication. We have a fully simulated operating room environment that allows all of those skills and teamwork activity to be practiced right here at the Sim Center. So this is really a gem, I call it, of our Sim Center. The Sim Center is full of activity, which is wonderful. A lot of research activity takes place in terms of improving performance of healthcare individuals, and that's an expectation of our patients, but also measuring the impact on delivery of patient care and the impact on patient outcomes, which is very hard typically to measure. That's being done right here, right now at St. Mike's.
So the telemedicine program at St. Michael's Hospital uses interactive video conferencing technology to deliver healthcare services, and those services include elective patient consultations, so two-way video. We also use video conferencing for education seminars for physicians and other healthcare providers, medical students, and for patient education. Patients don't always live close by to the hospital, and they need to travel great distances in some circumstances to see their healthcare provider. So telemedicine really helps to increase access to care. They have the opportunity to use telemedicine to link back and get support from St. Michael's. Telemedicine actually bridges that gap, allows those patients to get the same type of service that they would get if they came down to St. Michael's. So the second application of telemedicine is the use of telemedicine, teleeducation we like to call it. So you can use interactive video conferencing to link more than one location across the province, internationally. What this allows physicians and other healthcare providers to do is to come together on a regular basis. So really sort of using telemedicine to educate patients.
What's going on with your own health or with somebody in your family, you can access it right from home. And for our staff, they can access it from their desks, or they can come right into the Patient and Family Learning Center. By having a centralized hub like the PFLC, people often feel a little bit intimidated with their healthcare providers. They're very busy people. So by having one central place that's just for patients and families, it's a little library just for them. I think it's meant to create an atmosphere where they can feel free to casually, calmly, and comfortably ask questions and get their information needs. Patient education improves people's adherence to things like medication regimes or other therapeutic modality regimes, so exercises or whatever it is that is part of their treatment regime. Access to the information that explains exactly why this is important for you in a language that you can understand, and being able to take that information home with you so that you can refer to it as you need. Studies show that this improves your adherence to those regimes, which of course improves your outcomes. And it actually increases staff satisfaction. The more people are informed with the right information. Anybody can access health information on the internet, but is it current? Is it reliable? Is it evidence-based? Those kinds of things. The information that we provide, we know that the quality of it is high.